A popular radio personality on St. Louis airwaves lost his battle with prostate cancer.
Jeff Burton with 105.7 The Point died yesterday, approximately 17 months after receiving his diagnosis.
Dr. Zachary Smith with Siteman Cancer Center joins us now with what men should know about this disease. And thank you so much for being here.
Happy to be here.
Let's start the conversation talking about just how common this disease really is.
Yeah, so prostate cancer is the most common cancer in men. It's about 270,000 men approximately each year in the U.S. Are diagnosed with it. So.
And if we look at the demographics, who would you say is most at risk when we talk about age, race, all of those factors?
Yeah, so it's a progressive disease as you age, like many cancers. African Americans are at higher risk than the general population, and more so than Caucasian Americans and Asian Americans. About 1 in 8 American men are diagnosed with prostate cancer, and it's about 1 in 6 to 1 in 7 for African Americans. That's probably age, family history is another one. The more first-degree relatives that you have that have prostate cancer, breast cancer, can increase your chance. But it's relatively rare to have actual genetic mutations that cause it. That makes up a small percentage of men that have prostate cancer.
So of course everyone wants to know what can be done to reduce the risk of getting prostate cancer.
Yeah, so luckily it's a cancer that's generally slow growing and it's easy to screen for. The PSA is a blood test that we use to screen for that. That's basically just a blood draw. We generally recommend starting that around 55 years old, between 55 and 69 for average risk individuals. And if you have a first-degree relative or your other increased risk, then we may start earlier than that. But generally speaking, seeing your primary care doctor and talking about it.
And of course, it's always important to know what the warning signs are. So what should men be looking out for?
So it's generally speaking, it's usually asymptomatic. So most men would not have symptoms, as opposed to colon cancer where you may have blood in your stool, or bladder cancer, you may have blood in your urine. Prostate cancer generally, unless it was advanced, would have no symptoms, which is why screening is important to your point. So we generally recommend talking to your doctor about screening so that you could find it, because you may have it and not have any symptoms. If you had advanced disease, you certainly could have the signs of an advanced cancer. But generally speaking, urinary problems, a lot of men get worried that might mean they have prostate cancer. That is more commonly just an enlarged prostate from aging, but it certainly is something that we're discussing.
Anything else men can do in terms of prevention besides screening, which is obviously very important?
So as far as there are a lot of things that we know and a lot of things we don't know, right, about the links. It is not a cancer that is as associated with environmental exposures like smoking, like with other cancers. But certainly diet and exercise are important. We're getting emerging evidence for almost all cancers that obesity and other unhealthy diets and things will likely contribute. So just the standard healthy living, healthy diet, is something that we would generally recommend. And then talking to your doctor about basically screening.
Well, this is good information to have, especially in light of what we just learned about Jeff Burton. It just shows you it can affect almost anyone.
Yep.
And pretty much almost at any age, right?
Correct. Yeah, we generally recommend after 55 starting screening. It used to be 40, and there's been at different ages or different points in time there have been different age recommendations, but generally around in your 50s. If you have a family history, we certainly recommend talking to your physician about it earlier, about starting screening.
All right, Dr. Zachary Smith, thank you so much for being here. We
Happy to
appreciate
do
it. And if you want to learn more information about prostate cancer and the Siteman Cancer Center, just look for a link on our website, fox2now.com.